Did a Trans Umbilical Breast Augmentation.
And how long ago?
6 weeks.
And can you tell us your experience?
It was wonderful. Still wonderful.
Wonderful. Wow, it doesn't get any better than that.
No, it doesn't.
Any bruising or bleeding or pain?
No.
Incredible. And how much were you walking on the first day?
A mile.
1 mile the first day, the second day?
2 miles.
And the third day?
Like a mile and a half.
Wow.
Mm-hmm.
And where's the scar?
You gotta find it.
You got that right. There we go. So there is no scars on her nipples, no scar on the armpits, and no scars on the breast. So the scar is right here, down there. Can you do a close up? I mean, even if I were to lift this, you cannot even see the scar. This is incredible, you guys. So this. I just love this surgery, you guys. This is miraculous. This is unbelievable. I'm going to be talking about this very surgery this coming Sunday, November 5th, at the California Academy of Cosmetic Surgery meeting in San Diego. We're going to meet with many, many doctors, and I'm going to teach them how to do this because I hate complications, and this surgery has minimal risk in complications. I'm going to have her turn to the side, turn slowly to the side so you can see the profile. Her breasts are still a little high, the breast implants, they still gotta come down, but and now turn to the other side slowly. But she looks incredible enough to do photos, right? We do photos at 6 weeks, but turn again to the other side. But at 6 months, right now they drop about 80%. At 6 months, they drop about 90%. At 1 year, the implants drop and settle in the correct position around a year or so. That's give and take, but many advantages to this procedure. And the most obvious advantage, one tiny scar, which is literally about this size, in the only natural scar the body has, instead of 2 scars, which are much bigger. I mean, a scar here on the breast is about this big. 2 of them is about this big compared to this little scar. It's incredible, right? The risk of infection with this approach, near zero. The risk of bleeding through the belly button, near zero. Which are the most common causes of capsular contracture, which is like a scar that forms around the implants and eventually breaks them and make the implants hard. That risk through the belly button, 0.2%. In our series that we presented with the Trans Umbilical Silicone Breast Augmentation in January of 2023, we haven't had a single one. The risk of capsular contracture is 0 with this approach. It's just incredible. But we're talking about previous studies by Dr. Dowden and others, 0.2%. But if you go through the armpits, for example, the risk of capsular contracture, through the armpits, for example, the risk of capsular contracture is 6.4%. So that's 23 times more. And that, my friends, is the most common complication of breast surgery. So why on earth would a woman want to have 2 incisions instead of 1? And why would they want to have a scar that's about 10 times as big? And why would they want to have 23 times the risk of capsular contracture? And the risk of infection is higher with the other approaches. And the risk of bleeding. Why would you want to do that? I don't understand it. Unless the doctor doesn't know how to do that, but we can teach them. We're teaching doctors throughout the world how to do this procedure. Thank you.